Happy Monday, everybody. It's Dr. Matt with Full Potential Chiropractic with your tip of the week. We had a really good question in the office last week. Someone was dealing with a gluten allergy. They thought they haven't got tested yet. They were asking a bunch of great questions, whether it was a gluten intolerance or celiac disease, and it's a lot to unpack just within the adjustment time there. So I wanted to make sure I got out to answer this question, because I'm sure if they have this question, there's tons of you out there that are dealing with the same issues. And I want to make sure we get the right information so you know where to go or what you can do, at the very minimal level all the way to the very top, because just shooting straight to the top, there's nothing left after that. So I want to make sure we do all the little things first before we just start jumping to the biggest, most costly things that we can do to try to get rid of it or help improve the situation. So celiac disease is an autoimmune disease. It's where your body fights itself. It's more of the gluten is a protein in wheat, barley, and rye. And in most cases, the immune system reacts to this substance and treats gluten as a threat. Now, the immune system, right, is responsible for making these reactions and response times and making sure that, your body handles it very well. Well, when the immune system responds, right, the body makes antibodies to, that protect the body. But in this case, because it's an autoimmune disease, these antibodies end up damaging the small intestine. This damage prevents the small intestine from absorbing any good nutrients. The effects and symptoms of celiac disease are all over the place, but in most cases they're instant, whereas the gluten intolerance is, usually a later response. So you can have sudden weight loss or gain in children, especially, where we start to see it happening. Can also cause they go outside of the digestive system, is headaches, rashes, ulcers, even joint pain and numbness in the hands and feet. So again, an autoimmune disease is very serious, and you want to make sure you get checked by your internal doctor to make sure if this is something you're dealing with because it can get very serious very quickly. The difference between, like I said, the celiac disease and gluten intolerance is the timing, right? So if we have celiac disease, most of the time, our bodies are going to react very quickly because your body just can't handle it. So your body's going to go immediately into response mode and start making these antibodies, which I just said, fight against you and start to damage your small intestine. Whereas the gluten intolerance, you can have something and then maybe later on you notice, that you're feeling bloating, maybe some diarrhea, but it's not very long lasting. So you definitely want to still get that checked out, but you also want to make sure you understand the difference between the two. Some symptoms that we see from celiac disease is anemia, celiac rash that you can get on your joints, headache, fatigue, acid reflux. The causes of celiac disease, there's some research out there where there's a genetic component, but anything, just like anything, right, the genetic component, right, is a very small, limited aspect. There can be different things that lead up into it where, the environmental factors in which you're living, the types of things that you're eating at an early age, how long or the duration of breastfeeding, right, plays a factor. How many GI infections at a young age, how many antibiotics you're on. So a lot of things come into play. So it's just how much you've disturbed your GI tract at what stage of your life. What are some things that we can do? Well, you can avoid it, right? So be careful of that, because gluten is everything. So you got to do a lot of research. Make sure you consult a nutrition expert or a doctor on this case, because avoiding gluten is a good thing, right? It can overall reduce the inflammation in your body. But a couple things, it can be really expensive and it can be very misleading. Just because something's gluten-free doesn't mean it's healthy, so be careful of that. You can take a couple supplements. Calcium, zinc, vitamin D are very good for your body when combating the gluten allergy or gluten sensitivity, I should say. Also, get a hold of your chiropractor, right? So we know the nervous system controls everything. That from all the way from the brain all the way down to the toes. So everything between your nervous system is controlling. So if you have a better nervous system response from your brain to your organs, glands, and blood vessels, right? That means it's going to have a healthier stress response in your body. And if you haven't checked out, obviously, if you've done all those, right, obviously reach out to your internal doctor, primary care physician. If you have a GI doctor already, make sure you're doing the right things first. And the small things, like I just said, right? Start with figuring out what you have, the different things, food diaries, try supplementation, avoidance, chiropractor, and then we want to make sure that you can get taken care of if you do have celiac disease, and trying to manage those components by a GI specialist. So if you guys have any questions on that, please reach out. Don't hesitate. There's so much more we can go down. I just want to do a quick video to clear all that up. Happy